are you? SJS Don't Go. I'm Mashell Sourjohn from AARP, and we are calling people across the country. Thank you for joining us today and participating in this teletown hall to talk about brain health in Indian country. Most of us pretty much know how to keep our bodies fit, but what about our brains? AARP is offering a great opportunity for you to learn from our Global Council on Brain Health, a collaborative from AARP, and several ways to maintain your brain's health. We are joined today by the National Indian Council on Aging, Executive Director Larry Curley, and Senior Vice President of AARP, Sarah Locke, with the Global Council on Brain Health. This is your chance to hear from and ask questions of our guest and get the latest information on brain health and Alzheimer's. This is an interactive call, so if you would like to ask a question at any time during this call, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name, a question, and place you in the queue. The sooner you press *3, the sooner you'll be online with our guest. We'd like to welcome our co-host today, Larry Curley, who is a member of the Navajo Nation with over 40 years' experience working with aging and healthcare fields. He has worked with Congress, other branches of federal government, and national organizations on aging to develop support for programs that affect American Indians and Alaska Natives. Welcome, Larry.
Thank you very much. It's a pleasure to be here, and I'm looking forward to talking with the individuals who will be calling in. So I'm excited about this opportunity. Thank you.
Great. And Larry, is brain health an issue in Indian country?
Well, I think historically there was a perception, and now we're finding it was a misperception, that the whole issue of brain health is something that they need not worry about, that there really is not a major issue out there in Indian country, that it's something that belongs in the non-Indian community. Those are perceptions that were held, I think, for quite some time, until more recently studies beginning to show, research showing that there is an increasing problem out in Indian country dealing with brain health and all of the issues that are attended to that issue, such as dementia, Alzheimer's, and I think that they're finding that this is going to be increasing, especially now when we're talking about 579 Indian tribes in the United States and 300,000 older Indians right now, with projections of over 500,000 by the year 2030. So this is going to be a growing problem. When you couple that with the caregiver shortage as well, those are things that we are very concerned about, and I feel that we need to get ahead of the curve on this particular issue.
Right. And so why is this so important for National Indian Council on Aging to address?
Well, there's a couple of reasons. I think that one that I know of is that right now we have a number of elderly out there who are suffering from dementia, Alzheimer's, and what we're finding is that there is a lack of caregiver support out there. And if we're talking about the year 2030 with over 500,000 older Indians in this country, that number is going to increase. The number of people afflicted with this disease is going to be a major problem. And when we start talking as well about the growing population that is moving off reservation, back in 1980, the number of Indian people still living on the reservation was close to 70%. And here recently in the 2010 census, it showed that number has reversed in the other direction, with about 60% of tribal populations moving to urban areas, 40% remaining on Indian reservations. And most of those people who are remaining are older Indians. And so if you have the outmigration of Native people moving off reservation, most of those are young people who are moving off reservations. It leaves the older people at home or back on the reservation alone, needing the care, which there's very little of. And so that makes us concerned that we need to begin to look at how can we begin to develop policies and programs that meet that particular need. And so that is a major issue. Secondly, I think that as the younger population and some older people are moving off reservation as well, that we're talking about a tribal member that has moved off reservation and might be dealing with the whole issue related to brain health. Among children on the other side of the picture, on the other side of the age spectrum, we're talking about young people who are off reservation. And there is a thing out there, there's a piece of legislation out there called the Indian Child Welfare Act, which protects the young children. And in our perspective, in mind looking at this whole issue, that maybe something similar ought to be looked at for older people who have moved off reservations. So that's just a thought off the top of my head, and some of the things that we are contemplating, looking at, and dealing with the issue in a more progressive and forward-thinking manner.
Thank you, Larry. Now, if you've just joined the call, I'm Mashell Sourjohn from AARP, and this is a live telephone town hall to talk about brain health. We're talking with Larry Curley from the National Indian Council on Aging and Sarah Locke with the Global Council on Brain Health. As I stated earlier, this is an interactive call, and we want to hear from you. So if you would like to ask a question at any time, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name, question, and place you into the queue. The sooner you press *3, the sooner you'll be online with our guest. We are also very thrilled to have Sarah Locke, Senior Vice President of AARP's Policy Research and International Affairs. She also leads the AARP Policy Initiative Brain Health to care for people living with dementia, including she serves as the Executive Director for the Global Council on Brain Health, a collaborative of scientists, doctors, and policy experts convened by AARP to provide trusted information on brain health. Welcome, Sarah.
Thank you, Mashell. It's great to be here with you and Larry on this call. I couldn't be more excited. I wanted to give folks a little bit more background about the Global Council. They may not have heard of it because AARP started it in 2015 to deal with the huge amount of conflicting information there is out there on what should you do to maintain your brain health as you age. So the Global Council is a network of 145 experts from all around the world, 22 countries, and more than 92 universities and organizations have formed a network of experts in this area so that we can issue clear and dependable guidance based on the foremost scientific evidence that is current today. Our overriding goal is to help people apply the latest scientific evidence to boost their cognitive health and live their best lives. So we have lots of information and different reports and resources that help people cut through the clutter when they read different stories about maybe eggs are good for you one year and they're not the next. To apply that advice of the scientific evidence to their own lives.
Wonderful. Thank you so much. Well, we're already getting some calls in right now. Let's take one. We've got Chris Garber.
Hello, my name's Chris.
Hi, Chris. What's your question today?
Well, I'm concerned about my wife's she's kind of losing her memory a little bit, but not to the extent that I think it's Alzheimer's. But also she's like 62 years old and wanting to retire, and we're going to have minimal insurance. So I'm wondering if there's like products out there that are like affordable that would kind of help our cognitive, or help our brain out, but they're not expensive. Or should I pay a lot for insurance to because the disease is going to get expensive?
So I can jump in and say, Chris, the good news is that no matter what your age, there are things that you can do to maintain your brain health as you age, and they don't have to be expensive. That's one of the best pieces of news that I can offer. We know that in 2015, 1 in 6 American Indians or Alaskan Natives aged 45 and older reported some kind of problems with subjective cognitive decline, problems in thinking and remembering. So it's a common problem that lots of people have. But the great news is what we call the 5 pillars of brain health are things that you can do, simple, inexpensive things to maintain your brain health and reduce your risk for cognitive decline as you age. And I'll just throw out the way I remember them is MRNDC, which is move, relax, nourish, discover, and connect. Those are the 5 pillars of brain health, and we know that one of the best things that you can do is exercise. And exercise is good for your heart, it's good for your brain, and the evidence shows that staying physically active at least 2.5 hours a week or 150 minutes a week, however you like to think about it, can make a tremendous difference in your cognitive abilities as you age. I can go into some more of the tips later on, but moving, making sure you have a healthy diet, getting good sleep and reducing your stress, and then learning new things. And when we talk about learning new things, we call that discover. It's the important part is challenging your brain as you age to think harder or do something new or novel. That has been shown to be very effective. And you don't have to spend lots of money on expensive brain games or supplements to help yourself in that way.
Now, Sarah, great question, Chris. And Chris mentioned he felt that he was seeing some cognitive decline in his wife. What should we be looking for?
So you want to look for normal aging is something that is perfectly normal to forget where you put your car keys, or where you might have a tougher time recalling names. That's perfectly normal and not anything to be concerned about. But if you forget where you parked your car in the parking lot, or you take the bus home instead of remembering that you drove, that's when you should go to your physician to get checked out to see if that is something that might be reversible or something that is a sign of a more significant problem. But a lot of people worry that they're slowing down or they can't recall names. We want to assure you that just because that happens, it doesn't mean that you're on the road to dementia.
We've got another call from Teresa Smith from Chicopee.
That would be Chicopee. Chicopee. Hi. I just wanted to ask a couple of questions and also give you a little background on myself. I am a retired social worker, and I have a good understanding of dementia because that was my specialty, and I worked with a lot of folks that had that disease. And I call it a disease because true dementia is viewed that way, as that's how it's treated. And there's early onset versus age-related, or that comes on later in life. And it can come on a number of different ways. It can come on because of, say, for example, alcohol abuse can cause a person to have that kind of a dementia can come on versus someone who has the type of dementia that's the Alzheimer's type of dementia that would come on like maybe later in life. you start forgetting things, and it's you don't forget that you have that where you laid down your glasses. You forget that you wear your glasses or that you have glasses, and it's a kind of a thing that just keeps getting worse and worse until eventually you no longer remember who's who or what's what, or that you even have people in your family that you know anymore. You no longer recognize people. But my question was, in particular to the Native Americans that we're talking to, is the Native American people that I've researched when I was in college. I was researching the population because I'm part Native American. Was it's typically closed population. They don't like to have outsiders coming in, and I say that in a kind way. And wanting to get help, how much help do you want to accept? And do you want people to just come in and help train other people to help you? What do you want to have in terms of help, and what are you willing to receive? And are you still feeling the same in terms of only wanting full-blood people to come help, or would you be willing to accept people such as myself? I'm not full-blooded, but I am part Native American, and I'm proud of my heritage, but I would be willing to help. I just need to know, what if someone wants my help.
Thank you for that question. This is Larry. Thank you. I really appreciate your willingness to be out there, and I think that's the kind of sensitivity and compassion that we look for. I think that in a lot of communities there is that feeling that we need help, and there is a reluctance in trying to find that help outside. I think it's also this whole idea that only Indian people can help Indian people. I think that's something that is a misperception. It would be very much like young people don't know the problems of older people, so we won't accept the help of young people. Older people only know older people problems, and then that's a misperception. I think that one of the things is that it also depends on the tribal community that you're talking about. If there are tribes that are out there who have experienced a lot of conflict with local communities, yes, absolutely, there will be a little reluctance. But I've also have a position, my view is that I have run across non-Indian people who should have been Indian. I've also run across Indians who should have been non-Indian. And so it's just the values of the individual that you're working with, and I am sure that one of the things that they need in the Indian community that I know of are really looking at individuals who really are out there, on a daily basis, on a weekly basis, on a monthly basis, becoming familiar with the community. I think too often people make a mistake of going out once, and if they don't get any kind of response, they say, well, I guess they're not interested. One of the things I know about working with Indian populations is you need to be persistent. You need to be patient. You need to be out there. And when you say you're going to do something, it is very, very important that one follows through and provides whatever it is that one promised to that population. Otherwise, it's going to be another one of those incidences and experiences that people will say, Indian people will say, yeah, they came out here and they spoke to us and they said they're going to help, and then when we asked them for help, they weren't there because we didn't see them again for a year. So I would urge all caregivers who are out there who want to help, who want to be of assistance to the Indian community, that they be out there, that they persistent, that they need to be patient, because you're also dealing with a governmental structure as well, because some tribes have a very strict getting on the reservation policy or regulation. So I would recommend that you contact the tribal government and see what the processes are and the programs that are out there, such as the tribal aging programs that are out there, and finding out how you go about accessing the reservation, how you get to provide the services that you're talking about. So it's visibility, it's persistence, it's a lot of patience.
And this live teletown hall is one of the many ways we are at AARP trying to help educate the public on brain health. This is an interactive call, and we're going to be doing some polling questions during this call. Our very first polling question is, would you like to receive additional information about how to maintain your brain health? If so, press 1 for yes. And as a reminder, if you would like to ask a question, press star 3 on your telephone keypad to be connected with an AARP staff member who'll note your name and question. The sooner you press star 3, the sooner you'll be online with us to ask questions of our guests. Let's go to our next caller. We've got Lydia Bell of Phoenix. Lydia?
Yeah, I'm right here.
Hi, Lydia. What's your question today?
My question is, what kind of training programs are you going to set in place so that you have good care for dementia people? I work with dementia people, and you've got to be a gentle person.
Great question. Thanks.
From the National Indian Council on Aging, we are recognizing that as an issue that we need to begin to deal with. What we're looking at right now is taking some of the studies and some of the training programs that are out there and reviewing those programs and seeing how culturally competent or how culturally relevant they are to tribal communities. And once we have seen what has been provided, what we are going to do is going to be looking at putting together a training program that meets the needs of Indian communities. That means making sure that it is culturally appropriate, that it is something that is culturally sensitive as well. So we are looking at developing a training program for the Older Americans Act, Title VI programs, and even to the area agencies on aging in this country, because there are non-Indian aging agencies out there that work with tribal communities, and to make sure that whatever training that they are providing to caregivers out there, that they are culturally relevant, culturally appropriate. So that's one of the to-do lists on what we at the National Indian Council on Aging are doing. So thank you for your question.
And this is Sarah. I'll just follow up on Larry's comments to add that there are a number of initiatives that are underway to try to respond to the growing issue of dementia. The great thing about the longevity bonus that's happening all across the country is people are getting older, but unfortunately that means that many other people as they age will get dementia. A recent study in California found that 35% of American Indians and Alaska Natives who reach age 65 will develop dementia, and that's 1 out of every 3 AIAN elders. So it's a huge issue. The AASHTO, the Association of State and Territorial Health Officials, have been working with the CDC's Alzheimer's Disease and Healthy Aging program, and they partnered with the International Association for Indigenous Aging to produce a series of health communication efforts to improve quality, availability of resources to address the connection between brain health and heart health in order to reduce risk for people so that they don't get cognitive decline. There is a roadmap for Indian country that the Alzheimer's Association and the CDC have been working on, and that's going to be released on May 13th coming up. So I think that will be a specific and useful resource that was tailored to be a roadmap for Indian country so that American Indian and American Native leaders can learn about dementia and start discussions throughout their communities to help address this. Like Larry said, I think that dementia and improving care for dementia is something that AARP is very concerned about. And one of the things, in addition to the Global Council, that I'm working on, a big part of it is that realizing that you can live well with dementia. Not every answer to the dementia problem is to find a new drug, but instead help people right now, today, live better with dementia, eliminating stigma and making sure that some of the conversation about caregivers, we can empower caregivers to help provide better care right here and right now is something that we're working on.
I think just like this is Larry again. One of the things I wanted to mention is that the National Indian Council on Aging is looking at the Older Americans Act amendments that is currently in progress right now on Capitol Hill, and a major issue that we have learned about and have been pushing for is the fact that there are very few caregivers out there, and a lot of it has to do with the funding available to train caregivers. And the National Indian Council on Aging has taken a position that Congress needs to fully fund Title 7B of the Older Americans Act, which is the caregiver program. And it's never been funded. And we are saying that this needs to be funded, especially in light of the data and the research regarding the prevalence of dementia in Indian country. So I just thought I'd let you know that as well.
Awesome.
We've also got a caller, Gloria Williams from Wichita Falls. Gloria?
Yes, where I go to the Indian hospital, they have a television that has like skits all the time and health information, do's and don'ts and things like that. And I'd like to see you do, some programs on memory and cognitive abilities, and then also send maybe do some packages or booklets or something that the family can do together for the person that is having trouble with the memory, to get that family involved. Because if the family isn't involved in helping the person, then they're not going to improve. But everybody needs to be involved, and maybe even have a workshop or something at the hospitals, maybe once a month or something like that, like they do the blood drives.
Wonderful. Great comments, Gloria. I appreciate your comment. We at AARP are working with Good Health TV, and we'll start putting information out on family caregiving, how people can avoid frauds and scams, and also on brain health. So we absolutely are working with Good Health TV, and you'll start seeing those messaging soon. We're currently in production for that. So thank you so much. And absolutely, both of our speakers today have talking about some of the caregiving resources that we have at AARP and NICOA. And Sarah, what are some other resources that the Global Council on Brain Health has?
Sure. So you can go to our website, and it's free online, the Global Council on Brain Health, all one word, globalcouncilonbrainhealth.org. And we have reports on all of the different lifestyle issues and what you can do today to improve your brain health. Practical recommendations and tips that are designed for people 50 and older to make the most of their brain health. A couple of other things that I know about and that the Global Council supports is AARP's Staying Sharp program. I don't know if you all have heard about it, but it's an evidence-based program giving you specific tips that you can take to maintain and improve your brain health as you age. There's articles, activities, food, recipes with healthy suggestions for what to eat, videos to learn what's good for your brain games that are fun and challenging, and if you're an AARP member, that is part of your membership. If you're not, you can join the stayingsharp.org, but there's a personalized way to take a brain health assessment to get a baseline of how you're operating and how your lifestyle affects your cognitive abilities. There's also, you mentioned, I think, specifically about what families can do. AARP published a memory activity book which gives some specific suggestions about what kinds of activities you can engage in that is just a terrific resource. Sometimes families don't know how to interact with their loved ones and older grandparents. This book gives some really practical, great ideas of activities you can do together.
Great, wonderful. And we have a call. As we know, working in Indian country, stroke and heart disease is a major issue. We've got Robert Perry from Odenville. Robert?
Hey there, how's it going today?
Great. You had a question for our callers?
I'm part Sioux Indian. My grandmother was full-blooded Sioux. And also I've had 2 small strokes that affected my vision. It happened in the back of my brain, but it also affects my memory too. And I've had a mild heart attack as well. And right now I've got breathing issues, but I got a friend that makes fun of me because when I go out the door, I have to check myself. Boots, pants, shirt, hat, phone, wallet, keys, change. I go through a checklist. And I've got my brother who is my guardian right now. And I just would like to know, at the rate I'm going, how soon will I digress? And what can me and my brother do to change all this?
Well, I'll jump in, Robert. I can't tell you exactly how you're going to progress in the future, but I can tell you if you engage in the 5 pillars of brain health, you'll have a much better chance of maintaining your brain health as you age. And those are the ideas of making sure that you're exercising, that you're getting good sleep, and that you can manage any anxiety or depression that you have through healthy lifestyle habits. Nourish, making sure you're eating healthy foods. It's a really common issue for Americans if they're not eating a healthy, brain healthy, or a heart healthy diet with lots of leafy green vegetables and grains, and increasing your intake of fish and reducing your intake of saturated fats. Those are critically important for you to maximize your brain health, no matter what shape you're in right now. So I really encourage you to adopt healthy living habits because it can make a big difference in your brain health.
And this is an interactive call, and this really takes us to our second polling questions. Are traditional Native American foods such as bison, salmon, and wild rice good for your brain? Press 1 for yes and 2 for no. And Sarah and Larry, you talked about it just a little bit, but are traditional Native American foods such as bison and salmon, wild rice, good for your brain?
Well, definitely the salmon. You probably have been hearing the stories and information about omega-3 fatty acids that salmon is really rich in. And it turns out that fish is terrific for your brain health. And so the Global Council on Brain Health really encourages people to increase their salmon and fatty fishes like that, because it's shown all across the world people that eat diets rich in fish have really good brain health. And so we encourage that. The wild rice and the good natural grains, a terrific source of vitamins and minerals, and it's good for your brain. The bison is, to the degree that it's a little bit lower in fat than some of the other meats, it can be better, but we really, or the Global Council, discourages lots of red meat, which bison, of course, falls into. So it's not that the Global Council says you should never eat it, but in proportion, you should really increase your leafy green vegetables, your berries, fish, and decrease your red meats.
This is Larry. I think in response to the question from the gentleman, one of the things that we are looking at and encouraging people to do, and talking with some of the federal agencies that have responsibility for providing the health and medical programs of the Indian Health Service, to what extent that they have as part of their triage, routine re-triaging, especially with older people, to do some tests and make sure that they have an assessment done so that they can gauge how people are doing in terms of their cognitive abilities. That would be something that one can talk with a local Indian Health Service facility just to make it part of the routine of the triaging effort. Part of what we are looking at as well, and something that I have seen happen in other parts of the Indian country, is since there is a high incidence of diabetes, which has a direct relationship with dementia, is that physicians at the IHS facilities need to begin to implement, and they have some areas implement as part of their triage, a check on their diabetes and gauging how far along it is and so forth, and making sure that people take up a preemptive strike on that whole effort. So I would recommend that as well.
And if you are interested in some quick and easy recipes, we do invite you to join us at aarp.org/Native Origins, where you'll find 3 short videos along with downloadable recipes from Chef Loretta Barrett Oden, who's a citizen of Citizen Potawatomi Nation, and Chef Freddie Bitsoy, who's Dene Navajo, and then the executive chef of the Smithsonian National Museum of American Indian. And then so let's go to our next caller. We've got Michael Gentry from Porter. Michael? Are you there? Oh, Michael might have jumped off the call. How about let's go to Christine.
Hello.
Hi, Christine.
Hi, I had a question, and I listened to, just came in on your last comments. But my question, which was sort of answered, was, has the National Indian Council on Aging worked with the Indian Health Services? As a former health director from the Louisiana Choctaw, I know that the diabetes program they have has certainly helped in seeing the decline of diabetes on reservations because of education programs and the services that have been offered through this special funding. I would love to see something on brain health in Indian country be also a funding to healthcare services.
Well, Christine, this is Larry. Thank you very much for that question, because one of the things we have always been concerned about here with the National Indian Council on Aging is that the Indian Health Service, as you know, has been funded at 40% of actual need. And so they're already 60% down in terms of funding. In that whole process, in other areas of the country where I have worked, I have seen programs that do deal with the diabetes issue. And I personally would like to see Indian Health Service, especially with increased funding from Congress, that there will be programs developed by IHS, and we certainly will be advocating for the establishment and creation of training programs at the IHS level to make sure that they are at least beginning to jump ahead of the curve on this issue, especially in the elderly population. From my experience in working in the Indian country, however, there have been very few doctors out there who are geriatricians working in the Indian Health Service. I remember at one time there was only one that I heard of in the whole IHS network who was a trained geriatrician. So we need specialties of providers that know that particular field that would be helpful to Indian country as well. So that would be my response to you, Christine.
And as a reminder, if you'd like to ask a question, please press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question. The sooner you press *3, the sooner you'll be online with our guest. We've got a great call from Beverly Buckley. Beverly?
Hello?
Hi. What's your question today?
I want to know, do you think medication and how it's taken and how many at one time can have an effect on the brain's effect with dementia? My mother was on several meds and was suffering with dementia effects. And another doctor, I took her to another doctor, her second opinion. He took her off all those meds and put her on what he thought she needed and less pills. And she came right out of the confusion. They were giving her several pills and to take her. I take my meds, but I take them like an hour apart. I won't take more than one pill at a time. But I thought when I was taking care of her that the woman that was giving her the pills was giving her several of them at one time. And she, as soon as they took her off of them, her mind was clear as a bell. So do you think that the meds that are taken and how many they're taking at one time has an effect with dementia?
Beverly, I'm so glad you asked that question. It is a fantastic question, and it sounds like you were right on top of it to have your mother evaluated with a second opinion. Medications can, in fact, have a big effect on dementia and your thinking. And it's really important that you're in regular conversations with your healthcare providers about the medicines that you're taking and whether that's interacting with supplements that you might be on. It's really critical. For example, there are lots of people who have trouble sleeping as they get older, and they take things like common over-the-counter medications like Benadryl. It can even be recommended by your healthcare provider, but medications that are commonly taken to help you sleep can really do a number on your thinking skills. The American Geriatric Society has created a guidance called the Beers Criteria for potentially inappropriate medication use in older adults. And there are all kinds of inappropriate medications like benzodiazepines, hypnotics, barbiturates, some of the antidepressants. These can all cause problems with thinking, increasing risk for fall. So if you're taking a number of medications, thinking about how they interact can make a huge difference in your thinking. So it's always a good idea to check with your healthcare providers and say, do I really need this medication? Or if I think I might need something to help me sleep, what can I do? Because often it's lifestyle changes that can be more effective and longer lasting to help you get the sleep that you need. And I would recommend folks on the call take a look at the Global Council's Brain Sleep Connection Report, because we've got some good information about that to help people, because definitely medications can really cause a number on your thinking skills.
Great suggestion. We've got another call, Sydney Nez from Shiprock. Sydney?
Hello.
Hi, Sydney.
Yeah, I just got a question. You know, we talked about child welfare, and it's a misdemeanor to neglect a child. Is it a misdemeanor to neglect elderly who have this disease? Because my neighbor does have it, and I saw him walking down the road with just a pair of slippers in the winter. You call the police, and all they can do is bring him home. We need to make the young people aware that it is serious to neglect them. Would that curb the neglection of the elderly? Is my question, I guess. Can you make it a misdemeanor to neglect those people?
Great question, Sydney.
Mr. Nez, this is Larry Curley. I share 그런 나이팅 기리기 바시 henson. I share I guess one of the things that I can say, being Navajo, having worked for the Navajo Nation, that there is a process that they have in terms of making laws and making certain issues come before the Tribal Council. And I think that the Tribal Council, the President of the Navajo Nation, the leaders of the Navajo Nation need to recognize this as a major issue. But unfortunately, I think many times I find out in Indian country that it's somewhat embarrassing for them to deal with that problem and deal with that issue of neglect. And that is something that there needs to be more recognition of the fact that neglect is a problem, and it should be something dealt with by the tribe at the tribal level. Whether there are codes that have been developed, I don't know, but I know that the Navajo Nation, I believe, has already classified elderly neglect abuse as a crime.
And with over 573 federally tribal nations across the country, there are many tribal nations that have not set up tribal elder abuse codes yet. So in order to be able to address it, it needs to be identified, and some tribal elder abuse codes need to be created. So if your tribe, first step is really to kind of look, check with your tribe to see if they have some codes in place, and if not, maybe work with the Indigenous Elder Justice Initiative to help start getting those up and running. We have another call from Sarah Davis. Sarah?
Hello?
Hi, Sarah. What's your questions for our guest today?
What's about people who've had strokes and they don't come back, their mind is just not back up to what it should be, like they got dementia.
Okay. Yeah, in Indian country we deal quite a bit with people that have had strokes. Sarah?
Yeah, I appreciate that question because one of the most hopeful things that I've learned from my experience with the Global Council on Brain Health is no matter where you are and no matter what your health status is, there are things that you can do to improve your brain health. And so when stroke victims, if they want to talk about the past, that reminiscence therapy can be really good for them to be able to talk about their past memories and can be very helpful. But it puts me in mind of one of the other major pillars of brain health, which is connect. And that is, we know that social isolation is really bad for your health. And now we know that it's really bad for your brain health too. So finding ways to connect with your friends, with family members, with your tribal connections, that's super important at maintaining your cultural identity and maintaining your identity of yourself. So connecting with others. And I noticed that one of the callers had mentioned that cultural activities like music and beadwork are great activities for brain health. Absolutely, because it gets you thinking and gets you moving, but also lots of times you can do those activities in connection with one another. And so that social connection is really important for your brain health, whether you are somebody that has had stroke or your memory is just a little not as good as it used to be or significantly impaired. There are steps all along the way you can do to improve your quality of life, and connecting is a really important part of that.
Great. We've got a caller, Bernadine Atlow from Slidell. Bernadine?
Yes.
Hi, what is your question for our host today?
I was given some medicine that affects your memory, and I was sometimes when I be speaking, I be trying to say a word, and I know it in my head, but it won't come out. And I was wondering, could that because of the cause of the medicine that they had me on? But I just stopped taking it about a week ago, or maybe two. Maybe a week ago.
Sarah?
So, Bernadine, it's a great question, and I would say that you should discuss that with the healthcare provider that gave you that medication. It is very possible that the medication is having effects on your thinking skills, but there may be substitutes for that medication that you want to make sure that you continue to take that may not have that same effect. But the question's always about whatever you were taking that medication for, whatever condition that you had, whether it's important for you if it's to manage your diabetes or to manage your cholesterol, to balance the risk of how it affects your thinking with how important it is to manage your other health condition. But I would strongly recommend that you talk to your provider, make sure they know that it's causing you to have thinking issues, and maybe they can order something else or instead wean you off of that and encourage lifestyle interventions as opposed to a medication.
And Sarah and Larry, we have so many great Title VI directors out there and CHRs that are helping our elders in their own homes. If they start showing signs of dementia, what should they do to help them?
I was just in the process of looking at that, and I'm knowing that a lot of the CHR programs out there are out in the field on a daily basis, checking up on people who need that kind of assistance. That in talking with the CHR directors, one of the things I think they really need to do is work closely. One of the problems, as I see, as the major issue that I see, is that in most tribal communities that I am aware of, and I know many, that programs seem to operate in silos. They have one program here, they have another program here, rather than beginning to take a look at a population health perspective. I think it needs a comprehensive approach. For example, law enforcement needs to be involved, making sure that there are checks on people who are vulnerable. Nutrition programs need to develop programs or at least meals that are nutritious and that assist in keeping brain health going. You need CHR's program to do the visits out there, social services to provide the needed services to people who are in that particular predicament. So it's a comprehensive approach, and as part of it, in my view, is developing a good planning structure, getting those entities and those organizations involved in the development of a plan to deal with the whole issue of dementia in the Indian country. And lastly, it also requires, in my view, the judicial branch of the tribe so that they can begin to look at whether there is a need for any type of a legal program such as a guardianship program or fiduciary program at the tribal level. I know that there are some Title VI programs out there that are doing some really fantastic stuff. For example, the one in Arizona, the Intertribal Council of Arizona, has some very exciting and very innovative programs in that particular arena.
And I'll just add to Larry's great comments that working with community members to understand there are things you can do to improve your brain health, and that dementia is not an inevitable consequence of aging, I think is really important. That people should go and demand health care providers address their cognitive health concerns and help them distinguish between what's normal aging and what is the disease is really important. I think the other thing is that the same kinds of healthy living that helps reduce your risk for cognitive impairment as you age are the same kinds of things that people living with dementia will benefit from if their caregivers get the appropriate support to help the people living with dementia actually engage in these healthy activities. So it's not, dementia isn't inevitable, and really insist that you talk to your healthcare providers about your brain health early and often is a really important change in the way healthcare system or the way healthcare is delivered. And I think if you ask for what we call the checkup from the neck up, as well as the rest of your body, that's an important change. And I think if providers that are doing their best to provide health care can help get those messages out to the community, that would be a great service.
Great information. Our final polling question of the evening or today is, will you be incorporating any of the lifestyle changes mentioned in this brain health call? Press 1 for yes and 2 for no. On behalf of AARP, I want to thank everyone for taking part of today's teletown hall on brain health. We've been talking with Larry Curley with the National Indian Council on Aging and Sarah Locke with the Global Council on Brain Health. Thank you so much for joining us today. As we end near the end of our call, would either of you like to share any closing comments?
So I'll just jump in and say, of course, the Global Council on Brain Health is a great source, and AARP has lots of wonderful information, including the Staying Sharp program that's available all across the country. But there's some great things that are happening. The public health actions to care for an aging population, and specifically information for a roadmap for Indian country, I think that is going to be helpful for people who are listening and leaders in your community to engage in. So I encourage everybody to check out the Alzheimer's Association resources, the CDC's resources, as well as AARP's.
Larry?
This is Larry, and I just want to thank all of you out there in radio and out there in Indian country and elsewhere who have called in to ask about what this growing problem is all about. And we have been around, the National Indian Council on Aging has been around since 1976 and has been involved in a number of issues that have helped older Indian people out there live a life that is dignified and hopefully longer lifespan, which has always been an issue. But with our organization, we are looking at all of these issues because it is comprehensive issues. Lack of funding, current attacks on the whole issue of tribal sovereignty, the lack of Indian people involved in the participating in the Medicaid program. Those are all issues that affect the health and well-being of Indian populations. And so this particular effort by AARP is greatly appreciated. I think it provides information to Indian country that would be helpful. And I think it also identifies some of the issues that need to be addressed. And I do appreciate this opportunity to share what we do here at the National Indian Council on Aging and what we can look forward to as well. Thank you very much.
Thank you so much, Larry and Sarah. Again, thank you for taking the time to inform our members on this vital topic. If you'd like to obtain valuable information through AARP's publications or on our website at globalcouncilonbrainhealth.org, you can also check us out at www.aarp.org/native origins. And also, if you're looking for some caregiving resources, you can go to aarp.org/caregiving. We also do invite you to check out NICOA.org for additional information on Alzheimer's and dementia and some of their wonderful resources. Thank you for participating in the discussion, and it's an important topic. We apologize if we weren't able to get to answer some of your questions. If you would like to stay on the line, you can leave us a message or a voicemail with your question or comment, and we would be glad to get back with you. You can also obtain valuable information on our website at aarp.org or by calling 1-888-389-5655. We appreciate you so much. Thank you, goodbye, and Mado.